Hello, everyone. Welcome to our description presentation. My name is Michelle Cost, and with me is Raina Brown and Nicola Howe. And we're here to present ServiceNet's program and description and evaluation. We're going to be talking about how the program works in the agency, what the services are that we provide, and our funding, where we get our funding from, and the successes of the program and continued success. So here I introduce Nicola Howe, which will be our first presenter. Hello, Nicola.
Thank you, Michelle. First slide, Raina. First, we'll be looking at the background of the program. The Adult Community Clinical Services. This is a primary section community service program of the Department of Mental Health Services in Massachusetts. What it does is support people who have mental illnesses in receiving ongoing treatment outside of a hospital settings. Before, these treatments were majorly in hospital settings and psychiatry hospitals. And there was an influx of these individuals that made the system very unbearable. So what DMH had to do was figure out a way, how do we continue to help these people and reduce the amount of emergency room visits. There was ServiceNet, on the other hand, who was dealing with having services in the psychiatry hospital that was located in Northampton. So what the two teams did was team up together, and DMH contracted out to ServiceNet how they can better help these individuals. Next slide. What happened in 1965 was that ServiceNet started with their state, with their organization advocacy for these mentally ill persons in the Northampton State Hospital. And in 1973, they developed their own agency, hence the mental health recovery section of their agency, wherein which we will be talking about Everstrong Street group home, and that we will be discussing much more about how we deal with the recovery-based part of that clinical service.
So the administrative data from ServiceNet, the administrative office is located in Northampton, Massachusetts, and the programs and services are offered all around Western Mass, Hampden County, Hampshire, Berkshire, Franklin, and Worcester counties as well. And we provide an array of services, psychiatric services, mental health recovery, child and adolescent services as well. Developmental services, service to those with brain injuries. We also provide shelter and housing and vocational and addiction services as well to folks in need. And the programs was developed out of an idea of including day programs, halfway houses, and community health centers as well. So Everstrong from ServiceNet, we actually have 5 female participants, and they come with an array of mental illnesses, schizophrenia, bipolar disorder, and severe depression. So we provide services to all these folks. And we're a very diverse group of females, French, Turkish, Caucasian, and African Americans as well. So when it comes to socioeconomic status, we see a lot of people who are unemployed. And so, and some are unemployable, if there's such a word. So they are dependent on their Social Security disability benefits to the Social Security Administration and food stamps as well. And we have three different languages: English, French, and Turks. And religion, we have the Islamic religion as well as Christianity. And age ranges from 25 to age 67.
So there is a lack of mental health care in Massachusetts. So with that, it's causing a strain on the emergency rooms within the state. So with that shortage of psychiatrists and other mental health professionals across the country, this leads to 1 in 5 citizens experiencing a mental illness in their lifetime and not having a place to go. And 50% of those will be identifiable by the age of 14 and 75% by the age of 24. Treatment through evidence-based practices such as outpatient treatment, medication management, and support, as well as intensive treatment and often specializing living environments like what ServiceNet is providing. DMH is the state mental health authority charged with providing treatment and support to adults with serious mental illness and for children with serious emotional disturbances. So individuals with serious mental illness have a life expectancy of 25 years less than the general population. And so individuals with serious mental illnesses can significantly improve their life with the right intensity of services, support, and evidence-based practice treatment. And we're using a recovery-based model at ServiceNet, so it's future focused on the prevention, early detection, and cure of mental health. This is also known as the medical model, which ensures that the biological causes are fully addressed and that people are provided the services such as medication-based treatments that they need, and patients are able to be directly involved with their own treatment. Which involves the personal empowerment model and peer support that people need to cope with their illness and work towards getting better. And this is an overall very holistic view.
The goals of the program are first to provide clinical management and to provide support of the recovery services and providing services to promote residents and family participation. The objectives are firstly to provide ongoing clinical management, that is in psychiatry evaluation crisis, alongside the Department of Mental Health and respite. And the program works hand in hand with these is that every month there is a psychiatry evaluation by the psychiatrist, that ServiceNet psychiatrist. If there is behavior issues that cannot be managed by the counselors at the home, crisis gets involved and to see if they need hospital evaluation or to be monitored by hospital, or they need additional medication or any further support. And if they're in a state in which they can't return to the home, then they will be sent to respite to recuperate until they can function in the group home. There's also the development of individualized assessment plan, and these are in which the participants agree on goals that they themselves believe they can meet. And most of the time, family members are present at this assessment plan. The program ensures that all appointments with care teams are done on a weekly basis. That is visits to primary care physicians, opticians, dentists, gynecologists, etc. As well as we ensure that all human rights are upheld in which there is a human rights officer present at every GLE. And the ServiceNet has a committee that oversees these human rights officers, and DMH have another committee that oversees ServiceNet entirely. The program provides housing for the client, whether in which it's a house or apartment complex. The ongoing objectives are, respecting the client's rights and their dignity, as well as the program provides logistics and daily operational support for the household, just food shopping, paying of bills, or making sure that all their needs in the house are met, or they perform their ADLs in the right way, and assisting them or prompting them to reach their goals. All the service function founded on treating consumers with respect and dignity, and fostering the involvement of their family members with the policies and the programs, as well as involving the same group members and their families with group counseling and meetings. There is a stability of cultural awareness in the program, in which everyone needs to respect each other's background or where they're from and ethnicities. The program focuses on the client's strength and not their weaknesses, and they encourage family bonds and focus on family strength. There is a sound therapeutic knowledge and individualized to specific needs. So the IEP goals are met to this one person and not anybody else, and they're individuals to them and their families, as well as we promote family participation to the fullness of it to the individual recovery.
How the program works in the agency. So group homes, they're located all throughout Western Massachusetts. And they're actually located in residential areas. So it makes it for a more homely feel instead of like an assisted living facility per se, which is great because you're living in a street with real neighbors and not just you know, an elderly person living in an institution. So our clients are ages 22 and above, as we had said earlier, and 5 female residents, and 24-hour care is provided for these folks. And they're provided 24-hour care if they're unable to do activities of daily living, that's provided for them. And like Nicola said prior to this site, you know, you go shopping, you really kind of want them to really have their independence, and you look at the strengths perspective, and you actually kind of lead by that, and actually self-determination is really great. While we provide the 24-hour care, but we really do encourage independence as well. And this is what this program really strives to do, give these folks more independence. We have social activities, outings to the movies, to the parks, you know, to events around the area. And family is involved because it's really important to have family come in and really see how their loved ones are doing and how they're thriving and the environment, and making sure that we are actually taking care of their loved ones as well. There's also continuity of care, collaboration with outside resources, like Nicola just said, making sure that they are going to their doctor's appointment and follow-up appointments. Those actually are very important as well.
And now on to the program evaluation. The first thing we have to look on if we will be evaluating the program, and of course we're evaluating the Everstrong Street group living environment home. And the first question that we looked at was, how can the state facilitate ongoing treatment, monitor, and reintegrate these individuals into society without actually having to do it themselves successfully? So this was Richard's question that Dimage posed at the beginning of giving the contract to ServiceNet. Now, on the part of ServiceNet is, does ServiceNet have the ability of organizing and communicating with the stakeholders and needs and the adversities of the community being served? And what is the level of reintegration into society by members of the group living environment? Has the inpatient and emergency room visits decreased at major hospitals since this inception or since this contract between DMH and ServiceNet? Raina.
And then we have the study design. So the patients, the 5 patients will be interviewed by or given a 10-question survey. This protects their anonymity, and this assesses the effectiveness of the program. By utilizing the data, we're able to create general interventions as well as evaluate the outcomes of the goals that are set forth by the GMH worker and the patient. And we're able to assess if they are actually utilizing the interventions that are being provided by the clinicians. And it provides an opportunity for feedback as well to not only figure out if everything's working, but figure out what's not working and how we can improve.
Sampling method. So the program evaluation, we actually utilize the non-probability or the simple sampling method. We only have 5 participants. So this was really conducive to this type of evaluation. We also utilize the qualitative approach, which is perfect. We only have 5 participants, and it really didn't give us a generalized idea, but just the insight to those participants. They were easily accessible, and it was no cost to the agency. Participants were right there within our grasp. We could ask questions, get the feedback, like Raina just said. The program actually ensures better service delivery and hopefully more successful outcomes from clients.
Okay. In measuring the data that we collected, it should be known that ServiceNet used the software company eHANA to deal with their reporting. And these reporting are specifically for the clients because it's very HIPAA protected. Billing is also taken care of. That is through their health insurance policy. So all information about billing, the insurance policy number, everything about the participant, this is where it goes in eHANA. There is interoperability as well, and that is data sharing with DMH. DMH has auditing of ServiceNet on a yearly basis, and we have to share all the data through eHANA with DMH. And we have to collaborate efforts with DMH as well. So there is a DMH caseworker working alongside each participant, and this is where all information is posted. This is all where all informations are vetted. The variables that we'll be using to evaluate the program is the number of police calls made to assist with behavior issues, the monthly reports on how goals are being met, the sources of stress. How does the participants deal with their stress? How do they manage their stress? The coping skills that they use, and the coping mechanism that they use when they're going through some issues that they just can't problem solve. Their financial management, and this is done through eHANA as well, where in which there is a budget that is set up, and then there's a rep pay account that ServiceNet has, in which the Social Security Administration deposits each person's checks in that account on a monthly basis. So this, we need to find out how this is being managed. We need to evaluate the support that staff gives to each participants, and how does participants do self-care, whether they're caring for themselves or whether they're neglecting themselves, or do they have to be prompted on a daily basis to do their ADLs?
Ethical consideration. So plays a really important role when we're doing an evaluation. We have to take into consideration privacy of each participant and really maintaining their maintaining confidentiality. And they depend on us to be honest and to be open and sharing of information. Who is getting this information? And nowadays, people are so afraid of their names getting out there. So ServiceNet, we ensure that we respect the privacy. We make sure that that confidentiality holds. We also gained informed consent from these folks. If they're not capable of giving us their informed consent, then we resort to follow up with the court-appointed guardian or healthcare proxy. And healthcare proxy is somebody who is in charge of making decisions for them, just in case of them unable to making the decisions for themselves. And we do this, we could do this in person or by the telephone. And we do have written documentation of that signed consent as well, just so we can have that documentation on hand. And so safeguards. We have to disclose the purpose. Why are we doing this? We have to really explain to these participants why this is necessary. It's not just for us, but it's also for them, us being able to better help them. And one of the things that we also do is we have a lot of people with mental illness, and we format questions within the questionnaire to avoid trigger words, because as we know, they've been through enough trauma already. So we're trying to avoid those words that's gonna like set them off, or maybe bring back really bad memories. Then our information, how do we store our information? We make sure they're stored electronically, password protected software that is used, and information is privy only to those team members involved in the client's care as well. And cultural awareness and diversity, we talked about that earlier. We see that these are really a diverse group of women. And so we have to be really aware of that everyone is different, because these are all 5 different and unique individuals. So social workers involved in the process and all the workers involved have to really be aware of people's, their traditions, their belief system. All these things are really important. So we have to look at the background of the participants, and we have to really kind of maintain their respect and dignity, and keep them informed in the process. Let them know what is going on, when the process will end. The outcome of the process. We have to evaluate the risk to them, and the benefit. Does the risk outweigh the benefits? And what are the outcomes? Is it going to be beneficial to these and other folks in other areas, agencies as well?
For the data analysis plan that will be used in a part of our evaluation, of course, we would have identified research questions, and we have gone through those already. And the hypotheses would have been coming under those. We'll select and access a data set and list inclusion, exclusion criteria. Now for this is that we're going to include adults 18 years and above, and excluding anybody who's younger than that. And of course, the age range at the GLE is 25 to 67. So we are okay with that criteria. We'll be reviewing the data to determine the variables, and I've gone through that already, the points that we'll be using for the main analysis. Selecting the appropriate statistical methods and the software. And of course, the software that we'll be using, of course, is eHANA, and that is where we'll be getting our data from. And creating the table shells so that we can get a good understanding of the data, and managing the data that we receive through the SurveyMonkey. Thank you.
And then some limitations that may be present during and while conducting this is the amount of individuals that are going to be questioned. Since there's only 5 people, this may limit and generalize what's happening within this population, and not maybe generalized beyond that. Also having informed consent and questions that are formatted and worded appropriately for the patient, and being mindful and trauma informed is a very important part of making sure that everything is worded appropriately for the patient.
Okay, and this is the end of our outcome evaluation. Thanks everyone for listening.
Thank you.